Are you nervous? Okay, so all the best way to do is, if you look straight, try keeping your eyes wide open. My name's Cassie and I work in ophthalmology as a HCA. So just gonna let you guys know a bit about what icare. So what the icare does is it checks the pressures of the patient's eyes. So it gives the doctor a basic idea how much fluid is at the back of the eyes. They're quite good machines because if the doctors are busy, we can do the pressures. Yes, they vary on the results because when you look at a pressure from a slit lamp, they'll be completely different to our pressures. But at least it gives the doctor the basic idea of it. So if the glaucoma patients, we have to regularly check the pressures just to make sure that they're not high. Because with glaucoma patients, we have patients that are on drops to control their pressures. So we use them a lot in our glaucoma clinics. And sometimes doctors, like with cataracts, if they want to check the pressure before the ops, like pre-ops, we check all the pressures, make sure that everything's under control before they do any theatre operations. They don't intimidate the patient, you just explain the process. That's like a little puffer that goes towards your eyes. Yes, it can be close to the eye, but it's not too close, the fact that you can't carry on blinking. But all you have to do is make sure that you keep your eye open, and it's a straightforward process. Hi Laura, you okay?
Hi.
Have you ever had these machines used on you before?
No.
So technically what these machines do is they check the pressure at the back of your eyes. So it's going to feel like it's close by your eye, but it's not. So if I can ask you to remove your glasses for me. Okay. If I can get you to look straight ahead, eyes wide open. Okay. So look straight ahead for me. Are you nervous? Okay, so all the best way to do is, if you look straight, try keeping your eyes wide open. If you want me to help you hold the eyelid, I'm more than happy to do that too. So whatever you're comfortable with, okay? So can you see the green light there?
Mm-hmm.
Okay, so it's 17 in that eye. Okay, I'm going to hold this one, okay?
Mm-hmm.
Sensitive. And it's 13 in that one. So your pressures are quite good. We range from the pressures of 8 and 21. So anything in between them numbers, we count as perfect. So your pressures are quite good today. And that's all it is. Simple as that.
So how are you feeling now that you've had this procedure?
Absolutely fine. You didn't feel anything. It's a lot nicer than what you anticipate it's going to be, and it's just, it kind of feels like a little tickle, if that.
Alright, so if you look straight ahead and just pretend you're in a steroid.
Okay.
Yeah. So 19 in that one.
It's hard not to blink.
And 19 in that one.
No.
It just feels like a weird, like, fluttering.
Yeah, that's how it is.
But what does that mean then if I'm 19?
So your pressure's okay. So they come under our good range, so it's okay. So like I said, anything between 8 and 21, they count as good, especially you're not wearing glasses, so that's alright.
Mm-hmm.
See, like when I have a migraine, because this is weird, so when I can't find anyone, I'll stand in front of a mirror and do it.
Yeah.
And when I do my eye that's got the severe pain in it, my number will come to like 27. And then I know that my migraines are stayed with really, really bad.
Yeah.
And that's when I speak to the doctors and they'll say to me, try putting some drops in, see if the dry drops calm it down a bit. But they're really good. I think they're really good. I don't think anyone could stand in front of a mirror and do it, but
Yeah.
you get used to them.
You do. It's really good at measuring the pressures. So if we've got a patient who's got like a neurological issue, like IIH, intracranial hypertension, or a tumour, if they have their pressures done and it's sky high, like in the 30s, and you know something's going on with the even if all the rest of our tests are absolutely normal, they will show up on there that actually something further back is going on.
See, like for example, on Monday, I had a patient and one of her eye pressures came to 72. so we had to put it as an emergency to be met.
Yeah.
The one in city centre, the city, like Tully Road, City Hospital, because we knew that something was really bad with the eye, because all she kept complaining was that she had really bad pain in it.
Yeah.
We're gonna do the pressures. Just to outrule myself, I always do it to my patients. I do it about 3 times.
Yeah.
Third time lucky. So when I noticed that it kept coming up 72, 74, 72, I go, you know what? I ran to the doctor. She goes, you know, bring her in because I think we need to refer her straight for emergency.
Yeah.
And then she was put into hospital.
But that's good from a patient's perspective as well, that it can do that.
Yeah,
Like
yeah.
put you at ease knowing, okay, something might not be right, but straight away you can get
I did say to her, I obviously put her in ease. I go, not that I'm a doctor or anything, but I'm going to go and speak to the doctor because that pressure to me is really high. That's why I had to check it on several occasions.
Yeah.
But she did say to me when I was doing it, because I am in a lot of pain. So it did make me feel better myself that I actually took her straight to the doctor to get her checked out.
Definitely.
But it's a good gadget, good little gadget.
Well, this is why I want to make videos like this as well, because that was honestly like, you know, nothing was uncomfortable about it, but as soon as you see it come to your eye, you're like, absolutely not.
It's just because you think of it as an angle, like it's so close, and it's not really that close.
Yeah.
It's like if you think of it, it's a finger gap between your eye and the machine.
Yeah.
Once that red light comes around the rim, then that shows us that it's in contact with your pupil, because you have to line this with your pupil. If it's not lined with your pupil, it'll be red, and it's so hard to get it. We're actually really grateful to have these kits because it makes life easier because they're compatible instead of having the big kits that you have at like opticians. And it makes life easier to make the patient comfortable instead of putting them on a seat and positioning them, because they're in their own comfort. All we do is get them to look straight ahead and make them feel comfortable as possible. So yeah, these are like a godsend to us. So for our company, they are really well worth it for our clinics too.